So this is a Trilogy device. It's a multi-functioning machine. It serves a lot of purposes and it treats a lot of issues. It's used at night to help, again, rest the diaphragm and keep the carbon dioxide levels low. It's used during the day in mouthpiece ventilation to help with dyspnea recovery. And it can also be used invasively if the patient decides that they want to go a tracheostomy route where they hook it up directly to the trach and bypass the upper airway. The machine is pretty easy to use. You can have a stand so you can roll it throughout your home. It has a travel bag so you can hang it on the back of a wheelchair. It has a battery, internal and a detachable, so that you can use it away from home if you need it. So when the patients are using it in the home and they're comfortable with the equipment, it's important that they have a couple of caregivers that are trained as well, just so that everybody has a little peace of mind when they go to use a complex piece of medical equipment like this. Of course, you always have the DME or the durable medical equipment support from the company that dispenses it, and they will have respiratory therapists on staff that can help with any questions or issues when it comes to using it. But it's pretty simple. Once they turn it on, they have a beep, and then the display screen will show them which mode of therapy that they're in, and they can watch as they take breaths in and out, as the pressure's delivered. It has a lot more visual notification if there's issues, if there's a leak, if something's disconnected, if something is kinked and the pressure's too high. So there's a lot of visual and audio communication with the device, where it will tell you in the display screen what the problem is, and then it'll give you the audible alarm so that you know you need to check the equipment. Makes it a lot more comfortable for the patient because they can look at the screen and see what the problem is. Makes it a little easier for them to troubleshoot what's going on. So you can look at the screen and it will tell you if it's running on the external battery, if it's running on the internal battery, if it's plugged in. So you have all of these indicators that are helping you maintain and keep the therapy at its, functioning level, so that if you have questions and something doesn't seem right, you can look and see what's going on with the device at any time. In this particular mode with the mask, this is how you would use it at night when you're sleeping. There's another circuit that I can show you for mouthpiece ventilation, so you can see how the patients use it during the day. A lot of times when patients go out of the home during the day, as the disease progresses, they can use the mouthpiece therapy throughout the day. It hangs on the back of a wheelchair, or a caregiver can carry it over their shoulder, or they can choose to wear the mask. And it's whatever makes the patient most comfortable. But at least you have the option, so that if you're out somewhere, you start getting short of breath, you're winded, you can take some recovery breaths and spend a little bit more time away from home doing the things that you would want to do. So the biggest distinguishing characteristic between the BiPAP or bilevel and a Trilogy is the mouthpiece ventilation. It has helped lots and lots of patients have a better quality of life outside of the home. It gives them an opportunity to be out with their families, to take part in family activities, their normal day-to-day activities, and have the ability to recover if they develop shortness of breath or get fatigued. It's just a regular circuit. It has a couple of different options at the mouth part. One of the most common is the mouthpiece. It's just an angled piece of plastic. The patient would put it in their mouth and almost smoke it like a peace pipe. So they would take a big deep breath in, the lungs will expand, and then they can exhale. The great thing about Sip and Puff, it works with the patient. It doesn't blow continuously. As you can see right now, it's currently in mouthpiece ventilation. There's nothing happening until you put it in your mouth and initiate that breath. So it's entirely patient driven. The patient is the one that initiates the breath, and when the patient's tired or done, they simply take it out of the mouth and then the machine stops. For patients who have bulbar symptoms that can't purse their lips on a mouthpiece, we also have a straw option. So they can put the straw in the mouth, and then any type of effort on their part to draw in a breath, it will sense and automatically deliver that breath for them. So the straw technology has really been a game changer for patients that have those muscular and facial issues. There's not really a safety concern when you're using it non-invasively. When you have it and you're wearing it via the mask or the nasal cannula or the nasal mask, you still have the ability to take it off and on. The patient is still breathing spontaneously. They're still in control of what's happening during sleep. So there's not really any danger to the patient. They're only going to benefit from that additional support for the diaphragm and the respiratory system during sleep. All of the supplies, when you have the Trilogy device and you're using it non-invasively, they're all included with the insurance. So there's not a separate charge for tubing, for masks, for filters, for humidifier chambers. All of that stuff is included in the rent for the therapy.